Well, thank you everyone for joining us. And it's right 10 a.m. So we're going to get started, and I believe others will be joining us as we move forward with our discussion today. Welcome to the Health Coalition of Passaic County's fourth Health Equity Roundtable. My name is Kim Birdsall, Executive Director of the Health Coalition of Passaic County. We are an organization comprised of over 80 partners dedicated to working together to address the social determinants of health and advance health equity. And as an essential partner to the State Office of Medicaid, as well as one of 4 New Jersey regional health hubs, the HCPC is the bridge connecting individual needs to community resources. We believe the best way to achieve health equity, where everyone in our communities has the same opportunity to live healthy, happy lives, is by understanding and addressing all of the factors in the environment that impact our well-being. For today's discussion, our title is Mental Health: Bridging Access, Reducing Stigma, and Taking Action. Millions of Americans are affected by mental health issues. According to recent data from the National Institutes of Mental Health, an estimated 21 million United States adults grappled with at least one major depressive episode within the past year. More broadly, each year 40 million US adults suffer from an anxiety disorder. The COVID-19 pandemic made things worse. It intensified feelings of isolation, uncertainty, and stress. And this mental health crisis has once again disproportionately affected low-income individuals who have been shown to be more likely to experience serious psychological distress. So why is this the case, and why are lower-income individuals at higher risk? Well, there are many interrelated risk factors, and all of these can compound one another, including but not limited to access to healthcare services and health insurance, financial instability, additional social determinants of health, such as unsafe housing, limited access to education, or stigma that's associated with accessing mental health services. Addressing these issues is going to take a comprehensive approach, including improving access to care, economic support, destigmatization of mental health, trauma-informed interventions, and all of us working together to address the social determinants of health in our communities. That's a lot to try to solve for in our 1-hour webinar today, so we are going to limit our discussion, but the main question is, how can we help address the mental health needs in our community with the resources that we have in place? I'd like to briefly introduce our panelists for today, and then we'll get right into our conversation. The full bios are going to be placed in the chat for everyone. With us, we have Annie Alonso with New Destiny Family Success Center, Kathy Barreto with New Jersey Community Development Corporation, Maggie Liu with the National Alliance on Mental Illness, and Kelly Harris with Able2. Thank you all for joining us today. We're really honored to have you with us for this conversation. We'll start with about a 30-minute discussion and then go into a Q&A. For folks joining us, please feel free to use the Q&A function at the bottom of the Zoom window, and we'll get to as many questions as we can. We will be following up with a recording of the roundtable and also any additional resources. So enough about me and me speaking. Let's jump in and get started. For our context today, we're going to have a few different buckets of conversation. And the first one we really want to open with is the local community perspective. Annie, I'd like to start with you. Could you tell us, start us off by talking about the unique mental health challenges from your perspective that you see facing folks and families in Paterson?
Good morning, everyone. Thank you so much for inviting me. My name is Annie Alonso. I am Family Partner Supervisor at New Destiny Family Success Center. And we assist about over 3,000 families per fiscal year. So we do see a lot of traffic. We have seen an increase of migrants from other countries, so immigration, in the past probably a year and a half. And some of the challenges that we see every day is, some families don't want to give their information because of their legal status. So that's a challenge when it comes to mental health. Also, domestic violence. We have seen many cases, not only women, but also males that would like to get the help, but they don't know how to. And this is a very sensitive topic, and definitely equal access to mental health services. That's a big challenge that we have seen in our community.
Thank you, Annie. So lots of challenges within our region, and thank you for the work that you do in working with folks directly in the community. Kathy, I'd just like to turn to you. You work with New Jersey Community Development Corporation, and my understanding is there's a new project that will put you really inside schools to address some of the needs of mental health needs of students. Can you tell us a little bit about that program?
Yeah, absolutely. Good morning, everyone. My name is Kathy Barretto. I am with NJCDC, New Jersey Community Development Corporation. We are excited. We have a brand new statewide initiative called NJ4S, which stands for New Jersey Statewide Student Support Services. And it puts us into the ability to kind of mobilize prevention and mental health services throughout all of Passaic County schools, grades pre-K through 12. So we're excited about this new initiative because it's heavily focused on prevention and mental health. And it does, in terms of, we're talking about limiting kind of, barriers to mental health resources. This is something that I guess identified that barrier and recognized that we need to be mobilized throughout the county as opposed to having individuals physically come to our space due to whatever limited resources they may or may not be presenting.
Thanks so much, Kathy. I think, Annie sharing a bit about kind of the families, but we know that mental health for youth is a specific challenge that, and, we appreciate the fact that you're in the schools. Can you talk a little bit about, I know it's a new program, but are there specific issues that young people are facing right now from your perspective that you could share with us?
Absolutely. So, yeah, we are definitely a new initiative, but we've hit the ground running. And one of the things that kind of the trends that we're seeing throughout the county, as diverse as Passaic County is, adolescents are adolescents, and they are faced with very similar, I guess, adversities, I'm going to say, for lack of a better word. Post-COVID, we're recognizing that there is a significant spike in anxiety. There's a significant spike in specifically social anxiety, which then turns keys into a school refusal, which then turns into a whole other, set of obstacles. But the level of anxiety is something that we've seen cross board throughout our county schools and throughout kind of the age range. It comes as early as kindergarten, first graders, although they have the inability to kind of physically put it into words, as they're kind of trying to express themselves, hands down, you can see it's anxiety. And it runs the gamut from kindergarten all the way up to even our seniors in high school. Their levels of anxiety are attributed to a lot more different, kind of challenges that they might be facing. But nonetheless, that baseline of anxiety is something that I feel is cross-board happening to, or is being experienced throughout all of our grade levels. Another thing that I would definitely say is the lack of, psychoeducation around using words like depression and, I'm just, so depressed, or I'm so this or that, kind of the extremes that our young people are thinking in. I'm so depressed today. Well, are you depressed? Or are we having a bad day? Or, kind of putting that into perspective so they're not kind of catastrophizing their day-to-day kind of barriers. Or just kind of things that they need to get through, to get their through their school day, excuse me. One of the other things that I will definitely say is that in addition to kind of the anxiety and the depression is that our kids are losing social skills, whether they had a ton prior to COVID and, didn't necessarily continue to develop those, but socialization is something, those skills is something that we are red flagging throughout our districts, and understanding that our kids really do need to learn to develop those socialization skills, stop interacting via text messages, have conversations, eye contact, all those good things. And I'm sure all the other panelists can agree with me in saying that that's something that cross board they themselves have experienced, but that's something in a short amount of time that we, all of our clinicians have been able to identify.
Thank you so much, Kathy. Maggie, I want to get to you in 1 second, but Annie, I'd like your reaction. Are there similarities as well in your experience to some of the areas that Kathy shared?
I mean, definitely, we work with families every day, and we have seen the struggles of the parents, because one of the things we do, we focus on relationship building, so we get to see the children and the families on a regular basis, so you can see the difference. Trying to bring those children to parent and child activities, and the parents are like, but they don't want to go, they feel some kind of way being around other children. So after COVID, definitely, and even with the youth, we have seen it firsthand. We used to get a lot of interns, and not interns, volunteers, and some of them have experienced depression, and they're maybe 14, 15, 16. And where do we go, right? So it's very important for this to happen, so we can find solutions to assist our generations, our youth, and our children.
Thank you so much, Annie. Maggie, so we're talking a little bit about some community-based, and we're going to dig in a little bit deeper through our discussion today, but can you share with us, from your perspective, some of the main issues that you see facing our community organizations as well as our service providers when we're talking about how do we address the mental health needs of folks in the community?
Sure. Thank you so much for your invitation. I'm really pleased to join this meaningful discussion. Really, we're addressing health equity. And just like my co-panelist, Kim, Kathy, and Kim, you both touch upon how we need to look at people's needs holistically, our needs holistically, with the social determinants of health. And Kathy, the NJ for Us is truly an amazing program that's born for this time. And I think that the need or the importance of social emotional learning among young people, and the need for psychoeducation for parents and caregivers has really been pushed to the forefront right now, because providers can be seeing you like once every other week, right? But then the caregivers or the individual themselves, the need for them to leverage their own resources and to be able to know more, be aware of the resources and the approaches, that comes in so important, because they are 24/7 there. So we have definitely seen the spiked need for parents or caregivers coming to us asking for resources, and what are some of the treatment agencies that they can go to, or and also primarily to seek empathy. I wanted to bring that out because we have NAMI, the National Alliance of Mental Illness, have a 6-session psychoeducation program for parents, caregivers, and other family who provide care for youth, age 22 and younger, who are experiencing mental health conditions, their symptoms. So the program, which is free to the participants, 99% of those who participated say that they wish that they know about this program earlier, because they get to be aware of what their own lens is. We don't want to be the what do you call it, the snow plowing parents, or helicopter parents, but we just looking at our young children going through the anxiety, just like Kathy mentioned, is really burning for them. So how do you, in that hot moment, be able to be intentional and have some wise strategies? So that's important. Another issues that you ask about what are facing community organizations or service providers, I do see all around wait lists. Wait lists of treatment provider agencies. Some of those actually have been leveraging the resources created in the pandemic, which is telehealth, trying to provide some type of remote service. Even that platform, we have seen wait lists, so that is something definitely we want to bring out, and to say that we understand that with funding limitation and sometimes the fragmented system, it is harder for the agencies right now. And another issue is maybe also related to what I mentioned, is the stress among the workforce in our mental health field. And it is something that I remember even our organization, we bring in therapists to do a debriefing session and how to do mindfulness. The approach can be applied in what area of our work. I really appreciate those resources. And I think that we cannot stress enough the importance of caring our own workforce so that they can in turn serve better. Another thing, and I wanted to bring it out because it was very salient this week, that we are taking the information and referral calls, and more we have seen the older adults who do not necessarily have the savviness of going online or Zoom support groups, right? And then they call, they say that, hey, I can still drive. I want to come to an in-person support group. But when we look at it, we gave them the information, they would say that, wow, these are all at nighttime, all after 6 o'clock. I don't drive when it's dark, and it's such a real need for our older adult generation. So I wanted to bring that out as well. Transportation is an important thing. And also, how do we think a different way in not just create support groups that are catering for work people, people with work life, that they can only be available after 6 o'clock, but also for the older adults who can be alert and driving around during daytime. So these are snippets of some of the things that we saw from the NAMI perspective.
Maggie, thank you so much for all of that. There was such a wealth of other things for us to dig into today, and a wealth of knowledge. We'd love to include all of those resources that you referenced post session today. So we'll make sure that we get those from you. And you really touched on in the discussion the fact that there are barriers and there are disparities, right? That none of us have been spared from mental health challenges as a result of society and COVID and other things. And so disparities, I think, can be by age, by location, by socioeconomic status, and that all goes towards equity. Annie, can you just speak a little bit about some of the disparities that you see from your perspective in working directly with the community? We're going to get into a project we're all working on together in a moment that I think will elevate that too. But if I ask you about disparities in access or needs for mental health support, can you unpack that a little bit for us?
Sorry, couldn't unmute. I would definitely have to say age. In this couple years, we've been working with the project that Kim will mention it a little bit. And a lot of the parents that we engage, they ask for mental health services for the youth. And this program in a specific, as Kim will mention later on, is for 18 and over. So that's been a challenge, definitely for us. Also in the area that we are, they're homelessness. So a lot of the homeless folks, it's a little bit hard to reach them. And we know that there is a need, but how do we connect with them? That's something that has been challenging for us. And like I mentioned before, because we serve a lot of our immigrants in our community, it's hard sometimes to assure them that it is okay to share their information with us to be able to get mental health services. So those are some of the disparities we have seen, for sure.
Thanks so much, Annie. And yeah, access and things that folks who might not be insured or underinsured and can't afford to access the services that they may need, which really kind of brings us into a little bit of a success story, hopefully, and something that we'll talk a little bit more about with Stigma. There is a grant-funded program that has been happening specifically for anybody who's a resident of Patterson that has been impacted by a mental health issue as a result of COVID. New Destiny is a partner in that, and so is Kelly Harris here with Able2. So Able2 is part of this grant-funded project to provide free mental health telehealth services for residents of Patterson. Kelly, I'd like to ask if you could talk a little bit to us about what Able2 is and how effective telehealth has been in delivering mental health services, particularly for folks who may be economically challenged.
Sure. So, my name is Kelly Harris. I'm so glad to be here. This has been a great discussion so far. I am with Able2. Able2 provides cognitive behavioral therapy through either phone or video technology needs. So it can be by phone or video. And it is for those that are 18 years and older. And it is an 8-week program focusing on depression, anxiety, or stress. And then we do customize it based upon their specific needs. And so, depending on whether that's a health need or other needs that they may have. And so, in general, the studies show that telehealth is just as effective as face to face treatment. The studies that are out there show that when it comes to symptom reduction, global functioning in improvement, there's really not a significant difference when you look at comparing it from face to face to telehealth. Really, what we see in this field of telehealth is we see a breaking down of some of these barriers, especially when we look at accessibility to care. And so, for example, in Patterson, opens up the door to providers that are outside of the Patterson area. So you have a much broader network of providers that we can pull from. Also provides a wider time availability for those. So similar to what we mentioned, with adults having morning appointments and evening appointments for those that are available depending on their work schedule. And then, so that broadens that area. Also with Able2, we really focus on setting up a framework of cultural competency so that we can meet diverse needs of the community or those that we're serving. So that cultural competency comes from training. It comes from even those that we recruit, or we're building this diversity of network as far as having multiple languages that are spoke by our providers, or having specifically, we have Spanish speaking providers. We're using technology services for translation services, and then also having our providers having those resources related to the specific needs of the cultures that we're interacting with. Even looking at like the SDOH needs and having a care coordination team that works to support our providers to help meet those SDOH needs. And so we've really, over the last nearly 13 years with Able2, we've seen consistent outcomes with our members. We've had nearly 3 million sessions or therapy sessions, and we've seen across all lines of business and demographics. So that includes Medicare population, Medicaid populations, and commercial insurance. So if you look at that whole collection there, we see consistently around a 50% or greater reduction in symptoms from their first session to their last session, specifically related to anxiety, stress, and depression.
Thank you so much, Kelly. And, as with any new program and any new approach or innovation towards things, there's always lessons that we can learn and ways that we can enhance and promote that. I just wanted to talk a little bit about that program. It's been the specific one in Patterson, I think, has been in existence for almost 2 years now. Annie has been involved as a community-based partner in trying to help spread the word and get folks connected who say, yes, that I do want to receive this service. And so, Annie, I think we've seen an evolution in the community response, and which to me goes to stigma. It was maybe a little difficult to get folks, used to kind of this support. And I just like your perspective, how the community has responded to this service really over time. Have you seen any changes? Unpack that for me a little bit.
Definitely. We have been blessed to be part of this project since last year, since phase 3. And it was supposed to end, if I'm not mistaken, June 30th of last year, but it was extended till next year, June 30th, 2024. And we were so excited because the beginning of it was challenging. The beginning of it was a lot of outreach, canvassing, talking to people. And remember, it was past COVID, people were not really open to talk about mental health. They had many pressing needs, evictions, food, illnesses, COVID in general. And so to talk to people about mental health, they were like, no, thank you, we're okay. But what we have seen on this second phase is that actually people are coming in asking for services. They want to talk to someone. They know they need help. And we're just overwhelmed because our goal was to, I think it was about 150, to reach about 150, and we are already past 150 in about 5 months. So that tells you that now stigma is going down. People are acknowledging that there is a problem, that they need to talk to someone. And as a community-based organization, as a family success center, it's all about relationship building. So all the families that we see come in, now we can talk about, hey, this is available for you. And they go outside and talk to other people about it. So it's really been successful because we see now there's a door open. People are willing to listen. They want help, and we're there to assist. So it's definitely been a success for us.
Thanks so much, Annie. And it's definitely an innovative approach. Maggie, you touched on it in your conversation about how can we incorporate, teletherapy. Kathy, I just would like to pull you in a little bit as far as stigma, and your perspective about obstacles, with the youth and integrating within the schools.
Yeah, I guess just geographically, Passaic County is a smaller county, I guess, but it's very diverse, where up county is very rural, down county is very urban, very inner city. So their barriers both look a little different. Up county, with it being spaces of it being so rural, it's definitely transportation, just basic access to how can we get to these providers. And just touching base off of what Maggie said, just the workforce in general is depleted. So access to mental health professionals is something that, although up county has very limited mental health professionals, down county is heavier integrated with services and more access, but the stigma associated with it down county is more prominent. And I say that because I don't want to be seen walking into the local mental health center. I don't want to be seen walking, leaving my classroom and maybe going to the guidance counselor, because it's already then labeled as, he's depressed, he has this, he has that. So with just taking that into consideration is just kind of the basic thought patterns of some of our adolescents when they're like, I know I need this, but I don't want anyone to know that I need this. I don't want anyone to know that I have access to it. And then when we get into barriers, we're talking about, financial barriers, lack of professionals as mentioned, limited availability, borderline just lack of awareness of what your community has to offer is something that is definitely something that we could do better on. And then in terms of just social stigma and mental health, it's significant, Kim. And I say this because oftentimes our chronically mental health population is seen oftentimes as devaluing our community, is seen as I guess just kind of, I'll leave it at that, devaluing our community and not being, productive members of our community. And it's like, okay, I understand that perspective from a tax-paying community perspective, right? But I also understand that individual, how do we outreach to that individual, bring them in linking? And it all kind of boils down to our rapport. How do we build rapport with the individuals that are hard to kind of engage in services, like the homeless population, or even our migrant population? It just kind of, it spirals into a whole other, set of needs that if agencies like our own operate from a lens of empathy, I think that rapport building just naturally happens. And I think Annie can definitely speak to this, it's kind of that rapport building just naturally I guess circles into a level of respect, a level of confidence, a level of absolutely, I can share this with you. But it starts with rapport building. It starts with tons of psychoeducation to kind of limit and reduce that stigma, identifying that the stigma exists, not sugarcoating it and saying, you know, yes, our community is stigma free, but what does that mean really? And it falls on ourselves as providers to really send that message. This is what stigma free looks like. I am in your community. I am where you are. I am where the homeless population generally is, handing out flyers, engaging. There is no fear associated with my outreach. And I can say that working in Passaic County, a lot of our providers definitely do a great job at attempting to develop that rapport. There's still a lot of level of resistance, right? Despite our trying to connect, there's just not enough of that, I guess, that independent wanting to know how, really kind of committing to being an active participant in your own mental health recovery is something that is definitely another barrier, I would say.
Absolutely. Thank you so much for that. I want to remind folks who are attending today, if you have any questions, please feel free to submit them. We're going to get to some Q&A with our panelists. This is a great discussion so far. I feel like we could talk forever. I wanted to bring Maggie, you back in a little bit for the conversation about stigma. So what I'm hearing from Kathy, definitely it's like that in person, you know, you see somebody walking out of a counselor's door and maybe there's, you know, conversations that are happening. Kelly, you mentioned how, you know, kind of the anonymity, I guess, to say for telehealth has been something that you've seen of value. Maggie, your perspective on that and any other innovative approaches that you've seen about how we can work to bridge these gaps?
Yeah, I just loved what my co-panelists are saying about the stigma. And, you know, Kelly, you touched upon how, Kathy, you touched upon how stigma-free really starts with providers, you know, and that truly it's a reminder for ourselves as well. We've been in this field for so long, and sometimes we are really blind to some of the things that we have grown accustomed to, or even from the earlier training, right? And the topic of stigma is really not new with NAMI, because it's from our earlier discussion. I understand that there are I wanted to bring out the 7 types of stigma that one of our NAMI bloggers actually brought up. And so the 7 types, one is the public stigma. You know, some of you definitely touch upon this, right? So this happens when the public really endures the negative stereotype against people with mental health conditions. And then we have the self-stigma, right? Just like what Kathy mentioned about the downtowners, they really self-stigmatize and they wanted to also wonder what other people are thinking. So that is perceived stigma, right? Perceived stigma is the belief that others have negative connections about people with mental illness. So I do not want to walk into that clinic because it's right by the supermarket, let's say, you know, so that is perceived stigma. Then there's the label avoidance. This is where a person chooses not to step out and seek help because they don't want to be assigned a stigmatizing label. And that is, you know, truly one of the most damaging forms of stigma, because that stops providers to help. So the next one would be the stigma by association, right? We experience that as caregiver, right? We are linked to an individual, a loved one with mental health challenges, and then we found ourselves in a bad position, even among relatives, right? Holidays is here, right? When you go to a family gathering, if you bring your loved one who has, let's say, severe anxiety, or they are on the spectrum, or sometimes it is also, you know, hearing voices. How do you protect and how do you interact? You know, so every moment calls for wisdom. So that's a tall order for a stressed family member. And then just now we mentioned about diversity. So we understand that this stigma by association is very, very strong in some of the cultural ethnic communities. For example, in Asian Indian cultures, you don't get married off if let's say your sibling has mental illness. That's it. And how do we work together to empower the family or the individuals to make decisions along the way when such a weight is on them? So that is something that we, some of our panelists were talking about empathy, right? Then there's also the structural stigma, the institutional policies and other social structures that really results in decreased opportunities for folks, with mental illness. And then we also have, some of us touch upon it, is the health practitioner's stigma. So this takes place when a health professional allows these negative connotations and stereotype about mental illness to negatively affect their clients' care. And I understand that it is a very sensitive topic, but it calls for education. It's just we don't want people to have bad feelings. We wanted to overcome all the structural barriers and personal barriers to get to cultural competence, something that Kathy and Kelly are talking about, definitely. And I think that Annie touched upon the relationship building that is so important. I think that even when we are talking about helping young people, that like high percentage of young people before they consider suicide or even having a plan for it, they would not tell anybody, but they would, I believe that it was for those who did tell someone, 50% of the time they told a friend. So one connection, one meaningful connection can turn the ship around. And that is something that we cannot stress enough about. Yeah. So that's
so
about
much.
the stigma.
Thank you, Maggie. And I feel usually out of challenges can come opportunities, right? And so I'm hoping through our experience and what Annie shared as well, that we're slowly starting to chip away at some of those areas of stigma and that folks are coming forward and saying, yes, I do need some support. So I'm hearing empathy, I'm hearing connection, I'm hearing that there may be tools that we have that have been shown to be effective, like telehealth or technology. Kelly, I'm wondering if we can talk a little bit about, how could we scale something like this? What role do you see technology or telehealth playing in trying to expand access, particularly for communities that may be underinsured or not have the financial capability to access these types of services? You're on mute.
It wouldn't be a Zoom meeting if someone didn't say that, right? So as we look at technology, it's everywhere. So we look at our teenagers in the school system, they're using their smartphones, they have access to technology all the time. Technology in itself is not going anywhere. Even a lot of our homeless populations, they get phones. They have access to phones. And so it is all over the place. I think of like looking at scaling and technology. I think technology has a huge place in stigma reduction, especially I think about, I'm a mother of 4 teenagers. They know about stress reduction apps more than I do. Like it is, they have downloaded them, they have tried them out, they are aware. So that is really, it remains like an area that they're really curious about. And so I think leveraging that is, as a provider and as a mom and as a community member, just like leveraging that comfortableness, like I can do this and no one knows that I'm doing it because I've downloaded it on my phone and I can talk about it. And chances are, if one of our even doesn't matter age range, like you look at someone who is concerned they're having a mental health condition is going to Google it before they go and actually speak to a professional, and maybe before they even speak to a friend. And so I think that as mental health providers, we're really looking to create as many pathways as possible for someone to either connect with their own personal self-care or connect with professionals. And so looking at reaching under served areas, we can use technology such as telehealth to reduce those things like transportation. You don't need transportation to go to a telehealth meeting. You don't need to take off work necessarily. So you're not worried about like, how am I going to take off work? How is that going to affect me physically or like financially by taking off work for that, because it takes out that commute. Thinking about someone who lives in the upper part of the county having to drive to the lower part of the county and how that might affect them to receive services. And then also we see those with disabilities or with physical limitations being able to connect to services because they don't have that physical burden of having to get out and have that meeting. So we see that a lot with either are those that are on disability or those that are in the aging population. And so it allows for that. We look as looking at the cultural stigma. I can speak personally. I have seen in my many years of practice, I've seen community members in telehealth that would have never come into an office. They don't want their car to be seen outside of a mental health center. It's not about once I get in there, it's my car that's outside. They don't want to have to ask off work or to leave early and someone ask them, why are you leaving work? Or even to communicate it to a family member that they're receiving care. And so I know several people who've said, I don't want my husband to know I'm doing this. So I have to schedule my appointment when my husband's not going to be home, or my wife, either or. And I've also seen it like as far as cutting down barriers specifically. Like I've seen professional men that I might not have seen ever in an office, but this is kind of a safe way because of that. Like you said, the anonymity. But I think that it's continuing to break down that barrier. And another thing I'll just kind of mention before I pass it on is that it's kind of like a soft start to therapy. And so when you look at something that's like, we're going to introduce you to a short, brief 8-week program. And so you look at it as like, just try it. And so I have seen so many people who end their treatment cycle and they end that 8 weeks that go, I really didn't think this would help me, but it has helped me so much. I was so nervous about doing it, almost didn't do it. And so what we see is if we can create like these pathways that are, it opens that door or bridges them to continue that lifelong process of continuing to care for their mental health, that relapse prevention, learning those skills that they need to continue their journey of wellness well beyond a brief telehealth program.
Thanks so much, Kelly. Annie, I'm seeing you nod your head. Can you just share with us maybe any successes from your perspective about folks who have participated?
I was just agreeing with everything Kelly said because it's so true. I mean, I think we also have to change the way we speak about mental health. And that's something we try to do on a daily basis with our community members, is try to find a way that they understand that this is not, you're not locked in for 8 weeks. This is just someone that you're going to talk to. Just give it a chance. If you have a problem, let's talk to a professional. You don't have to, because when we say mental health, people say, oh no, I'm not crazy, especially culturally, our population, our families say, oh no, if you talk to someone, you're crazy. And we're trying to break that. So having those conversations, even amongst our staff, we have so many, over 9 programs, and it has become part of our conversation when we assisting a family able to. So when you're just speaking about something and you just bring, hey, this is a service and it's free and it's just someone that you can talk to and it's going to listen to you, they agree. They say, okay, I can talk to someone, but we have to change our language and we have to become more creative. Sometimes you have to add a little something different depending on the population. There was a season that we did art therapy, and that worked. We brought community members, we brought the youth, we brought the seniors, and we were not saying mental health. it was art therapy, but there was a piece included. So we have to become more creative when it comes to reaching out to our community members and talking about mental health. That's what I think.
Thanks so much, Annie. And I think Kathy, you started to talk about it a little bit, but really, I grew up in a time pre cell phones, not to date myself, and pre technology, but you had that social connection with your friends and with others maybe within your community, and you felt like safe to be able to maybe share things, and sort of in a way that those relationships I think helped. And we have sort of lost that as we have evolved in a way. So I'm hearing that we need to bring those connections back, and there's various ways to do that. Um, we're going to be at time. We will end at 11, and I don't want to go into the policy lane, but I do. And I'm going to pick on you, Maggie, and then we'll get to you too, Kathy. But Maggie, my understanding, through the pandemic, we had lots of policy things that were put in place that allowed for new ways to do things, including, let's say, telehealth for mental health therapy. Can you talk to us a little bit about, are there things coming that are going to change those policies, or what else from a national or state level should be or could be put in place to reduce these disparities and increase access?
Yeah, this is such an important question. And I think that we all need to know more and then leverage that, and on the state level, we understand that actually this month, marks the second anniversary of a program called Arrive Together. It is a co-responder program in which mental health screeners would accompany police or arrive after on calls involving mental health issues. So police are in unmarked cars so as not to escalate the situation further. We understand that this is a pilot program from the Attorney General, Matt Peckin. So from 2021, it was started in Cumberland County. And then right now, because the result has been so positive, and as far as the de-escalation, very few arrests or use of force because of this program. So it was expanded to 10 other counties. And the next year's budget include funding for all 21 counties. So, however, it is not a 24/7 program, and not all the municipalities will have access to it, but it is very worthy to keep an eye on it and see how we on the local level can advocate for bringing that program to the local. And now nationally, we all have heard the 3-digit number 988, right? It is to replace the lifeline for suicide prevention, but it is really a mobile crisis outreach response team on the ground level that makes 988 work. So it really serves as the quote unquote someone to come arm of 988 is the mobile crisis outreach team. So we would like more awareness of 988. Just now Kelly mentioned about the texting, platform, the telehealth. That's so important. So 988, people can text anytime. They can call. If it's youth, they can text a second floor. That is another platform that's used more frequently during the pandemic. So with these programs, we wanted to address this access issue of how we work together, all the moving pieces in the system to make sure that if someone's having a crisis, they have someone to call, somewhere to go. And so that will trickle down to all the levels of our system. And another thing that I don't want to leave without mentioning, which is the Governor's Council on Mental Health Stigma. So that one has been really ramping up its efforts to enabling and empowering municipalities and counties to become stigma-free. So on their website, which I will share later with you, Kim, maybe, to really put out resources, templates, examples of how to get it done. So from the town or county leaders, they can declare that our town or our county is stigma-free. They will have documentation, and they will have next steps and what are some of the things that their constituents can do to jump on the bandwagon And that would be something that would be a great resource. Now, on the more agency level, or even on the town level, I really highly recommend a free presentation called the NAMI's in Our Own Voice program, because among many studies, effectively reducing the stigma pointed to one intervention, which is hearing a story or real contact with someone successfully managing a mental health condition. So with this In Our Own Voice program, people with mental health conditions would come out in pairs. They're all trained to share their powerful personal stories in a either 60-minute or 90-minute presentation. So I would truly advocate for this program to be invited into all of your programs, even for the clinicians themselves. It would be so helpful to have that connection and to hear the story, so that the inspiration and also the empathy would be increased. So that is something that I want to mention too.
Thanks so much, Maggie. And yeah, please send all those resources over. We will distribute them out, not only to folks who participated today, but to our larger network up here in Passaic County. The more we can keep having these conversations going, Stigma-Free campaign is great. It's the start, but we need to, as Annie mentioned, it took about a year or so to really get folks warmed up to the point of saying, you know what, yeah, I would like to talk to somebody, and let's see how it goes. So I think we're all in this together, and really appreciate those resources to get that started. So I think we've heard a little bit about one innovation with telehealth and how that can work. And hopefully any policy initiatives at the state and federal level will still support reimbursement for those services. I'm not clear where we landed on that. I don't know, Kelly, if you have anything, but I did want to get to Kathy on another innovation. So Kelly, anything about that reimbursement policy or? Oh.
Got it. All right. As we think about reaching specifically this underserved community, I think as we look at policy and community, as far as our community goes, really, I just encourage you, audio only is really only been allowed right now through waivers and things like that in many areas, based upon it's really the provider's burden to figure out or to discuss, learn whether or not audio only is allowed either by their payer or by their state and by the federal government. And so COVID opened those doors for a lot of audio only, which is needed for these communities that have technology barriers. And so as community resources, I would just really encourage the focus on either lobbying or knowing, as you know your population, to reach out to your community leaders, your state leaders, and make sure that that access continues for those populations that may be technology limited. And so personally, I think that's another piece, is technology education. Many of our communities have that. And so allowing that technology education to coincide with mental health. And so making it a comfortable conversation for them to have. And then I do agree completely with the others on the panel is, oftentimes when I meet with clients, I will talk to them as I'm providing support versus therapy, because the word therapy has a stigma for many people. So how can I support you through this journey of where you're at, this life transition, this situation? And so I do think they're more comfortable with that language. So I agree with the panelists where we are, and I'm excited to be here with NAMI. They have great resources, and also those of y'all who are on the ground in the Patterson area. So
thank you so much, Kelly. So I'm going to go our last question to Kathy, and then after that, we're going to do final thoughts. So Kathy, I only probably have about, a few seconds. We do want to end on time, but I wanted to go to you about a little bit more about the program and the innovation in regard to your involvement with the school system. What role do you see school districts and parents can play in this, and just kind of leave us with a little bit about that innovation.
Sure. I believe NJ for us in general is breaking down the barriers of kind of brick and mortar situations. And what that means is that if a clinician is stationed at one specific school to help that individual space, they necessarily can't go to the school next door. NJ for us doesn't have that, I guess, that barrier. We're able to kind of mobilize every school system that will have us. What's important for our schools and I guess our administrators to understand that the only agenda that we have is one of prevention. And we're trying to shift our school systems that are super stressed from being kind of reactive to a more proactive standpoint. And that way we increase prevention services so that we can kind of taper off some of those high acuity needs that for those individuals that need to be referred out for psychiatric, referrals or for whatever reason. So I believe in short that the buy-in for our program comes in with understanding that we are there to lessen the burden of their existing system and to provide mental health and prevention services throughout their school communities to be able to take out some of the hurdles that are kind of hindering their academic overall performance. There's no academic achievement without mental wellness. And identifying that connection is something that I feel NJ4S is something that would be able to highlight that within the next couple of months or year to come. Again, we're a brand new we're building the plane as we fly it. So we will see, but I will say that in a short amount of time, we have been able to do some significant impactful work around just psychoeducation around mental health and prevention.
Thanks so much, Kathy. And thank all of you. You are committed leaders in the community and in this space, and so are certainly playing a critical role in advancing mental health equity. But I'd like to ask each of you, and I'll leave it open to whoever would like to go first, what would you leave our audience with? What are your thoughts on what does the audience need to understand about their individual role to advancing mental health equity? Because you all are playing a critical role, but everybody has a part in this. Go ahead, Annie.
I would have to say, because NAMI, you said something very powerful, and it is your story is your power. So if we're able to gather our youth, our adults, our elderly, and speak about mental health, whether it is through a campaign or I don't know what we can come out with, that's going to be something that can impact our community. Listening from our community members, and of course, in partnership. Because it takes a village, and that's why we're here. So thank you so much for inviting me.
Thank you, Annie. I leave it open to Kelly. How about you next?
Yeah, no, I think it's right. We just got to continue this conversation. We got to continue to share our personal stories. We try new things because someone we trust told us to try something new. And so we need to continue to do that. We need to continue to this conversation as far as economic and demographic disparities and learn from each other and learn from the community how to reach the community. And so it's really about just continuing this narrative, this personal conversation, and and in fact, being a part of it ourselves. So taking care of our mental health on our own. And so I'm glad that, we've all mentioned at this table that even professionals need to be taking care of ourselves and our own mental health. And it really starts with us. And then that personal conversation that continues throughout.
Thank you, Kelly. We'll go over to you, Kathy, and then Maggie, you'll bring us home.
I guess just off of the conversation, I just want to say that mental health is holistic. There is no mental health without housing. There is no mental health without financial, availability. There is no mental health with food insecurity. So I feel that when we talk about it takes a village, it absolutely takes a village. And how do we connect them to all of those moving parts is the way that we definitely secure a baseline of mental health so that they can continue to maintain that. But just going down to Maslow's hierarchy of needs, like their basics need to be there first in order for individuals to really tend to their mental health. And seeing mental health as separate from your overall medical health is something that we need to kind of bridge that gap. Mental health is physical health, and it starts with absolutely our own health as providers.
Thanks so much, Maggie.
Well, I think that all my words have been spoken. I truly agree with that. And I think that we all have a role to play, and stigma training needs to be ongoing instead of a one-time thing. And in terms of starting with ourselves, be aware of where our own limitations are and be intentional about not judging. I said before, like, we are never competent enough to outgrow the need to listen. So thank you all.
Thank you so much. And we are at 11, so I just want to say a final thank you so much to all of our panelists, and thanks everyone for attending. Whether you are directly involved in patient care, provide mental health resources to caregivers and educators, or just want to learn more about how to be a better advocate for people, our collective impact is far more powerful when we do work as a network rather than working in isolation. So in the coming days, we'll follow up with a recording of today's roundtable, as well as those additional resources and a link to sign up for any news or upcoming events from the HCPC. Our mission is to connect community partners across all of these sectors so that we can together drive health equity, which is a big part of why we're having these roundtable series. So thank you so much. We look forward to seeing everyone at our next one, which will be in a few months. And happy holidays to everyone.
Happy holidays. Thank you.
Happy holidays.
Thank you.
Thank you. Bye-bye.